Are you wondering whether you should get tested for the new coronavirus? Well, that's a question many Kenyans are asking themselves and their doctors. But before you turn up at the hospital, the medical fraternity says you need to understand why and how this testing is done. Asha Mwilu asked most of the questions on our minds about the coronavirus test and now reports.
This weekend will mark the beginning of a new phase for Kenya's response to COVID-19. Mass public testing for the virus. But as Kenyans roll up their sleeves ready for the tests, the medical fraternity says not too fast.
We know that we're doing testing in the country. We know we've had cases of coronavirus in the country. And there's a panic. You know, everyone's calling us doctors, calling the healthcare facilities. Can we come and get tested? How do we know we have or we do not have coronavirus? And I think it's very important that Kenyans get clarity in who should be tested.
I woke up with a runny nose. My throat is not okay. I feel like I have some of the symptoms. Should I get tested?
Have you traveled? Have you traveled abroad? No. Have you been in contact with anybody who's had the coronavirus?
Not that I know of.
So the symptoms are common. You know, about 2 months ago, if you had the flu, you wouldn't even complain. You wouldn't even come to a doctor for that, Asha.
So for my flu symptoms, I simply get screened, and at 36.4 degrees Celsius, my temperature is at normal range, and that's enough to rule out the virus for now.
Thank you.
But suppose one presents themselves with all the symptoms.
Fever, cough, shortness of breath, history of travel, positive contact.
Then you would have to immediately wear a mask to avoid the possibility of infecting others. And then you would be taken to an isolation room, and the person taking the sample will have to wear protective gear. Nothing is left to chance.
A specialized nurse or doctor will come into the room and do a nasopharyngeal swab.
Just cooperate. It's very quick as well. It's not painful.
The swab is inserted into your nose, right to the back, almost close to your throat, and they will move it around to get the cells. And the reason we do it there is that's where the highest density of virus is.
Okay.
The test is painless and takes only a few minutes. The sample, however, has to be handled with a lot of care because of the contagious nature of this virus.
So now we give it to the lab.
In an actual scenario, the person taking the test would hand over the sample to the lab technician to take it to the pathology department.
It's a molecular test, and you need a molecular lab to do the test. And there are many hospitals in Kenya, but it's a test kit. And once we get the test kits, we have to validate them. There's a whole process. It's not that, oh, let's just buy this equipment and set up this lab and anybody can do it. So there are lots of controls. You do not want to release a false negative. So somebody who has the virus, and we say they're negative, and you don't want to release a false positive, somebody who doesn't have the virus, and we say they're positive.
The last step is really when the virus jumps from person to person and transmits in the community. For now, we haven't detected that. We have got some difficulty in the testing kits. So there's a limitation of testing kits. So they really have to be used for those suspected cases that are meeting the case definitions, so that we can keep it for those. But we are quite urgently trying to source additional test kits to be able to make sure that we can test many more people.
So our patient samples are in the lab now. He has to wait 24 to 48 hours before he can receive his results. In the meantime, he must self-quarantine from home for 14 days. He should wait for his results to be given to him via email or telephone. He's at no point to come to the hospital. If he tests positive, the rush to trace all his contacts begins. It's a simple process for the patient, but for lab technicians and doctors, it's a little more complex than your average blood test. It takes a longer than average time to confirm an accurate result, and for a disease as highly contagious as COVID-19, the best bet for Kenya's healthcare system right now is to rush against time to slow down the spread of the virus. Asha Mwilu, Citizen TV, Nairobi.